Hello everybody. Today I will explain about what is MSDs, Musculoskeletal Disorders, or call it MSDs, are injuries that affect the muscle, joints, tendons, and nerves due to poor ergonomic practice. For example, workers who sit for long hours with bad posture or perform repetitive tasks are at higher risk of developing pain and injuries. These problems are commonly seen in workplaces such as office, factories, and construction sites. By improving workplace design and workplace practice, we can reduce the risk of MSDs and promote better health, safety, and productivity.
Good day everyone. Today I will explain the importance of ergonomic in the workplace. The main objective of ergonomic are to enhance efficiency of work, increase quality, and achieve a higher level of safety, health, and comfort. To achieve this objective, ergonomics focuses on the job itself, including job demands, job tasks, working environment, activities, and techniques of work. At the same time, ergonomics also consider the worker's characteristics such as human factor, age, gender, medical history, maximum strength, limitations, stress, and understanding. This means ergonomics is about matching the job requirements with the worker's capabilities. In conclusion, when both job factors and human factors are properly balanced, it improves efficiency, quality, safety, health, and comfort in the workplace. So, in this video, I will explain the role of temperature in ergonomics. Temperature is an important factor because it directly affects a worker's comfort, health, and performance. If the temperature is too high, it may cause heat stress, dehydration, and fatigue. This can reduce concentration. On the other hand, if the temperature is too low, it can cause discomfort, reduce hand movement, and slower reaction time, which also affects work efficiency. In ergonomics, temperature should be controlled based on the type of work being done. Physical work may require a cooler environment, while office work needs a stable and moderate temperature.
The scenario you just saw an example of an ergonomic risk factors, which is work posture. The sitting position shown is not friendly ergonomic. As you can see, the chair design does not support the back properly, which can lead to neck, back pain, and increase of musculoskeletal injuries.
So in this video, show a poor lighting condition where a person is using a laptop in a dark environment. This creates a strong contrast between the bright screen and the dark surroundings, which can cause eye strain, fatigue, and headache. It also affects posture as the user may lean forward, leading to the neck and back pain. To improve this lighting condition, we should use moderate ambient lighting and adjust screen brightness to a comfortable level. Proper lighting condition is important to ensure comfort, safety, and work performance.
Banyak kerja assignment. 244, 248, 246. Banyak betul. Ni 231 lagi. Lepas tu kena edit video lagi, buat Canva lagi. Aduh, dia ni asyik tekan aku je. Alah, bukan aku seorang je yang buat. Satu group buat. Nak cakap je kat aku.
Next, I will explain about contact stress involving the shoulder, which is one of the ergonomic risk factors in the workplace. Contact stress happens when the shoulder experiences continuous pressure or contact with hard surface or from carrying loads on the shoulder for a long period. For example, workers carrying heavy sacks on one shoulder or working in positions where the shoulder constantly pressed against a hard surface may experience contact stress. To prevent this, workers should avoid a prolonged pressure on the shoulder, use the proper lifting methods, and take regular breaks. That's all from me. Thank you.
The solution is: first, adjust workstation height, keep work at elbow level. Second, use ergonomic tools that match the task and hand posture.
3.
Next, keep frequently used items within easy reach. Next is maintain neutral posture, straight spine, relax shoulders, restrict. And the last one is take micro breaks, which is turn and change position regularly.
Hello everybody, today I will explain about forceful and sustained exertion, which is one of the common ergonomic risk factors in the workplace. It refers to tasks that require high physical effort such as lifting, pushing or pulling heavy objects, especially when done continuously over a long period without enough rest. For example, a worker lifting heavy boxes repeatedly and through the day may experience this condition. This can lead to muscle strain, back pain, and even long-term injuries if not properly managed. To prevent this, workers should use a proper lifting techniques, take regular breaks, and use mechanical aids like trolley. Let's move to the next slide.
For the effects of ergonomic risk and impact, musculoskeletal disorder or MSDs is injuries and disorders that affect the muscles, nerves, tendons, ligaments, joints, cartilage, and spinal disc. It's caused by many of these, such as poor environmental conditions, vibration, contact stress, static posture, forceful exertion, repetitive motion, and open posture. Why it matters? Because it leads to absence and higher healthcare costs and impact workers' health and productivity. And for the another related injuries, and for the first is upper limb disorders. There is many injuries such as the Quervine syndrome, trigger finger or thumb, that is the most common for workers. Digital neuritis, radial tunnel syndrome, epicondylitis or tennis elbow, tendonitis, and carpal tunnel syndrome. Okay. When in our life, we always use our hands, and especially fingers. And sometimes, when we use too hard, it will make the trigger finger when it feels that our tendon in the fingers feel very hurts. That sometimes it's very dangerous. Okay, for the neck and shoulder disorders, which is the most example, thoracic outlet compare and tension neck syndrome, also rotator cuff tendonitis. Okay, for the tension neck syndrome, this is the most. This is the this is always have at all people who always busy when doing work and not take care of themselves. So on. There is many general effects such as long-term disability risk, reduced range of motion, chronic pain, ligament sprains, and also muscle or tendon strains. Uh, this is include back and spine disorders, that's ruptures or herniated degenerative disc disease, and mechanical back syndrome.
Ergonomics play a vital role in creating a more productive environment. It is not just about the design of chairs and desks. It is about the space, task, and the body's posture while performing a task. When practiced properly, ergonomics can minimize discomfort and injury, support better focus on efficiency, and contribute to overall well-being, whether the classroom, office, or industrial setting. Good ergonomics lead to better outcomes for individuals and organizations.